அனைவருக்கும் வணக்கம். I am Lghsc Sherlin, Standard 7, studying Lghsc Girls Higher Secondary School. I am also a student of Junior IAS Academy.
இன்னைக்கு நம்ம ஹியூமன் anatomy லெசனில் கிளினிக்கல் anatomy-னா என்னன்னு டீட்டெயிலாக பார்க்கலாம். Welcome friends, pleasure morning to all. Today we are going to discuss about human anatomy. What's the topic? Human anatomy, part 4. The very important branch of anatomy is the cross-sectional anatomy. Now, this cross-sectional anatomy, why it is so important is because knowledge of this anatomy helps you to diagnose various diseases, especially through non-invasive procedures. So, all the non-invasive procedures, especially nowadays, what is you used to call this CT or computerized tomography or MRI, magnetic resonance imaging. Of course, then positron tomography. So, on keeping on saying, but what happens? You should have a sound knowledge of this cross-sectional anatomy. Certain section given up any level, you should be able to appreciate the structures, and also you should be able to differentiate the normal from the abnormal. So, here for the sake of illustration, I have given a sectional of 10th thoracic vertebra. What all structures encountered? Of course, you are able to see on the right side large structure. You able to see the liver, and for you this is actually the stomach, and of course the spleen able to see here, and this is vertebral canal. In the spinal cord inside, and all these are muscles of the body wall, abdominal wall and posterior back muscles. You will be able to see that only you should are very much thorough with this normal anatomy across sectional level. You will be able to identify what is abnormal. So, cross-sectional anatomy, it is a very significant role in diagnosis. Of course, we all know we would have come across these pictures in our lifetime at least once in a way. It is a X-ray or something. X-ray is a term used only in a lab. The correct term is actually called as the radiograph. We call this as a radiograph. So, radiographic anatomy is which mainly radio waves. So, here you able to see a plane. This is mainly responsible. You can appreciate bones and especially to find out any fractures or whether the development without of the bone or the healing process of bone is normal, that is one thing, then of course it is not only about radiograph. To play a radiograph or X-rays, nowadays what we have called as the ultrasonograph. Then of course I has already mentioned you about the computerized tomography and other MRI images. So with help of the MRI images and computerized tomography, you would be also able to appreciate the soft tissues, whereas in a normal plane radiograph you will be able to appreciate bones. So this branch of anatomy mainly deals with the radiographic anatomy. Of course, so you see radiographic anatomy, microscopic anatomy, developmental anatomy, surface anatomy. So, but ultimately our knowledge of anatomy, we should apply actually diagnosing or during the treatment. So applying your anatomy knowledge in the disease process or in the diagnostic outcomes our to actually to treat the patient, our perform certain procedures where your anatomy knowledge comes into act, and that is actually called as clinical anatomy. For example, you see something called as thoracentesis, where the fluid must be aspirated. So when now to aspirate the pleural fluid, naturally what happens if you going to insert the needle, you should know what are all the structures it is going to pierce right from the skin till you reach the pleural cavity. So that is anatomy comes. Save the here we can see various points if you have actually, but here stethoscope you can ask so many sounds. Most commonly this is the apex beat. இன்னைக்கு நம்ம ஹியூமன் anatomy லெசனில் கிளினிக்கல் anatomy-னா என்னன்னு டீட்டெயிலாக பார்த்தோம். மீதியை நம்ம நெக்ஸ்ட் வீடியோவில் பார்க்கலாம்.